Hello and welcome to a Health Podyssey. I'm your host, Alan Weil. The human lifespan has grown dramatically in the past century. While there's been some reversal in recent years, improvements in the United States are short of other countries. We still live much longer than we used to. But American institutions haven't exactly kept up with these changes. It's often noted, for example, that life expectancy at birth in 1935, when Social Security was created, was only 61 years for white men. It was barely more than 50 for men who were not white. Male life expectancy now hovers around 75 years in the United States. Female life expectancy tops 80. So how can people navigate these extra life years? What should people expect in their newly gained years? These are questions we'll discuss in today's episode. I'm here today for a special recording of a Health Podyssey at the Aspen Institute Ideas Health Conference. I'm here with Debra Whitman, Chief Public Policy Officer of AARP and former staff director for the Senate Special Committee on Aging. Dr. Whitman, who I've known for a long time, so she's told me to call her Deb, is author of a new book entitled The Second 50 that seeks to answer big questions people may have about midlife and beyond. So we'll discuss what some of these questions are in our conversation today. Deb, welcome to the program.
Thank you for having me.
So I love that you've written a book. I've always thought about doing it and never managed. What led you to decide to write the book?
So I've been working on aging issues, as you talked about, for the last 25 years, so a quarter of my life. And I was about to hit age 50. And two things. One, I realized that there isn't any good resources out there. I had books on my shelf of what to expect when you're expecting. My kids were going off to college. I had tons of those books. But what to expect when you're aging wasn't out there. And then second, I wanted to learn more. Even though I worked on these issues, I wrote down a list of questions that I wanted to learn about. And some of them I knew more than others, but really spent a couple of years doing research and understanding the data behind all of the questions that I was asking, and then talking to experts and people across the country. So it was a bit of writing it for myself and the book that I needed, and also kind of a teaching tool for the work that I do on my day job.
Well, some of the best books are books written by people who are writing for what they want to know. And so you said you focused on questions. Where'd these questions come from? You said you were interested in them. How'd they come to you?
Yeah, I wrote down a list, and actually the list was too long, so I condensed a whole bunch. But I ended up with 7. So the first one's how long will I live? And it's all about life expectancy and how it varies across the population by income, age, or income, race, gender, and what we can do to extend our longevity. The next one was, will I be healthy? All about our health span. A lot of conversations we're having here this week in Aspen at Aspen Ideas Health. A little on geroscience, which is a new field. I looked at, will I lose my memory on cognitive decline and dementia? How long will I work? Thinking about the fact that work is increasingly a huge part of our second 50. But also we face age discrimination, so talking about those issues. Will I have enough money? Everything on pensions and how Social Security works. Where will I live? Where I covered housing and accessibility, as well as long-term care. And then how will I die? Which I knew very little about since I have not experienced it, but it was probably one of the more interesting chapters to write. And then because I've been working on this stuff, and my day job is all about finding ways to change policies to make it easier for people to age well in America, there's a really fat chapter that you and I will read, and maybe some of your listeners, that my mom skipped over, which is how do we make a better aging America, and all of the different things that we need to do to improve people's lives as they age. So that's how it came together. And it's been really fun because it's really 7 books in one, but really fun to talk to experts and say, and about things that I thought were true that they tell me are actually not. So that was, I think, one of the joys of writing it.
Oh, can you give me an example of that?
Yeah. So in the How Will I Die, I interviewed Dr. Diane Meyer, who's a palliative care expert. You probably
we've published her many times.
She is.
Yep.
She is amazing. And I think one of the things you might have published was her study on advanced directives. And so I've known Diane. She did a fellowship on the Hill when I was there. And I said, Diane, everybody needs an advanced directive. And she said, actually, we've just learned that they don't work. And then I said, well, everybody should die in their home. And she said, no, a lot of people don't have the support, and a lot of caregivers don't know how to help ease through the dying process. And so, two of my fundamental things I was going to talk about in that chapter, one conversation was nixed, and greatly so, because, again, I think we have a lot of preconceptions about what aging is and isn't. And so having a baseline of data and information was really what I tried to put out there.
Well, that's the great thing about framing a book around questions, particularly someone like you who is open to learning that what you thought was the answer isn't the right answer. And when you look into the data and you talk to the experts, you get new knowledge. That's great. Well, I know we can't walk through the whole book, but I want to at least tease the first couple of chapters that look at lifespan and healthy aging. So I know it's not really fair because the book is very comprehensive, but if you could just tell our listeners, what do you want people to know about these two topics? And maybe that'll tease them to get the book and read about those and the others.
Yeah. I think when I was starting to look into lifespan and understanding, and I knew the research had shown that U.S. lifespan for the first time in history was actually declining, and wanted to understand both why that was and also what makes somebody live longer than somebody else. And most people think it's their genes, right? My parents lived to a certain age, that's how long I'm going to live. But genes are only about 20% of determining our life expectancy. A lot of other factors, as you know, social determinants of health, vastly outweigh the genes. So your zip code is more important than your genetic code. There's also well-documented differences between men and women. So across the world, women live 3 to 7 years longer than men. But I found a really interesting study of monks and nuns in Germany. And so the piece of that difference is gendered behavior. Men don't go to doctors. They fight in more wars. They're more aggressive. So that's a piece of it, but that's not true in a cloistered environment where they're eating the same food. And so even there was still a 1-year difference based on biological differences. I also looked at differences by education. So people with a college degree live about 7 years longer. And in fact, if we had everybody living what a college degree person had, we would be one of the longest lived countries. Instead, we rank about 40th in the world, largely because of these disparities. I was writing this during the first part of the pandemic, so I really looked at racial and ethnic disparities and tried to understand some of the causation and really try and get behind the numbers, because we have vast difference between Asian Americans who live up to almost 84 and Native Americans who live to 65. And remember, the Social Security retirement age is 67. I grew up in eastern Washington State next to the Colville Reservation. And so it didn't make it all into the book because of my word count. But I spent a lot of time really thinking and talking to people about why those differences were. So all of these are social determinants of health and biology. And as I said, we have huge differences across the country in where you live. But there's things that people can do to live longer and healthier. And I try to put those things in the books too to get people excited of sort of news you can use.
Yes, I'm always struck when I'm at the Aspen Ideas Health Festival that a lot of people in the audience want to know what they can do, and it's very personal, as these issues are. As you mentioned, the disparities and this notion that if everyone lived as long as people with college education, we'd be much better off. I do recall from work of the Commonwealth Fund that in many dimensions, even sort of our best performers, best states or regions, they often still fall behind other countries. So even when we take our sort of the slice that is most advantaged and most likely to be healthy, it turns out that there are enough other drags in our system: gun violence, automobile accidents, some of the loneliness that you talk about in the book. These can actually offset the advantages people would otherwise have.
Yeah, and one correlated with education is income. And so if you're in the top 1% and you're a man, you live 10 years longer than the bottom 1%. Women live 15 years longer by wealth. But even as you said, if we compare our best, most wealthiest life expectancy to the wealthiest in other countries, we are falling behind. And I think we don't often think of lifespan as a measure of a country's worth. I'm an economist. We talk about GDP, right? Or a whole bunch of range of things. But this notion of having more time, like just think of having a decade longer to live and all of the things that you can do with it. So when we think about both what values in a society and also when we think about disparities, this is a piece that I don't think gets enough attention and enough direction. And what we don't need to do is have higher income people get new technologies, and there's a huge push in Silicon Valley for everybody to take all these supplements, and I'm sure you've seen it in the online and others. But what we're not focused enough is how do we raise the bottom? And I think public health has a huge role to play, as well as many of our healthcare programs as well.
Yes, the notion that we are in essence stealing 10 years of life from people by policies that leave them in circumstances that make them less likely to thrive is a much more pointed way than saying, oh, yes, we have however many $1 trillion of GDP.
Well, and I carry that through, too, because, Social Security is designed to be progressive. It returns a higher amount for lower income than it does for higher income. But if you get 10 more years of Social Security, it wipes out all that progressivity. So, between Social Security, Medicare, and Medicaid, there's actually a huge wealth transfer because of longevity that you miss if you look at the year-by-year numbers.
Well, I want to talk to you about that chapter that you and I and our listeners are likely to read that maybe your mom will skip over, because I know you have a strong policy background. So we're going to move into some of the policy implications and some of your thoughts about that. We'll do that after we take a short break. And we're back. I'm speaking with Dr. Debra Whitman, who is about to release a book looking at the second 50 years that many people will be able to live. We've had a great conversation about some of the factors that affect people's longevity and healthy life. There are many other questions that you address in the book that we won't have time to cover here today. But I want to tap into your experience as a staff member on Capitol Hill in what I always think of as one of the last bastions of true bipartisan efforts in the Senate Committee on Aging. I guess I'm going to ask a very broad question. People always ask me this question, drives me nuts, so forgive me if it drives you nuts. But when you look at these questions and the answers that you have for them, are you optimistic or are you pessimistic about our ability as a society to help people navigate the second 50?
I'm optimistic and frustrated. I have been working on these issues, sort of chiseling away. So, earlier in my career, I was on the floor for the Part D drug debate. I was chart girl for Senator Kennedy. When I was in the Senate Aging Committee, we were pushing things on retirement savings or on nursing home care. And we made steps, and we keep making steps. And that's one of the things I'm proud of where I work now at ARP is we're fighting the fight every day. But I'm frustrated because after 25 years, I was hoping for giant leaps. Last time they touched Social Security, I was a freshman in high school. And at the moment, the latest trustees reports say that it will run out of money when I'm 64. And you can't not touch an important program for that long. Because it has huge consequences. I don't know how much I'm going to get in retirement. People want to know. They care. They're worried. They're concerned. So we need our political system to really look at these issues. And that's why I sort of put it together in this way, in a comprehensive way. Because, as I said, whether we have income in retirement affects our health. It also affects where we can live and whether we can afford care. All of those things are interrelated. And so while I go chapter by chapter with solutions, there's some common themes of things that we need to look at.
So I hate to frustrate you even more, but of course, Social Security in some respects is easier to fix than Medicare or Medicaid. Maybe we should spend a moment on that because that's also an area you know something about.
Yeah, I mean, there's intellectually easy, and it's math, right. And Social Security. There's politically challenging,
right?
Because there are tough answers. And, I think over time in healthcare, we have made some big steps. So Medicare didn't have a drug benefit before the Medicare Part D discussion. I was also there during Affordable Care Act and expanding coverage by millions of people, and including for the second 50 of us, removing things like the ability to discriminate by previous health conditions. So we have made lots of steps. There's lots more to be made. Even if we look at our healthcare system, even though Medicare and Medicaid are some of the biggest payers, it's not geriatricized. I don't think that's the exact word I'm looking for, but I'm going to make it up if not. We don't have a geriatrics workforce. In fact, the number of geriatricians is declining at the same time the aging population. And we need to figure out across all people who are in the healthcare system, how do we train them to deal with really complex care? That's something I think your authors in Health Affairs have been dealing with for decades of the many, many different things that we need to fix. I don't have a silver bullet because this is more complicated, as you know well. But I do think looking comprehensively about aging is really important. I do put as the first solution in mine is to have a national plan on aging. Most other countries do. Several states in the U.S. too. And between the time I wrote it and the time it's going to come out, the administration is putting out a framework for a national plan for the United States. What's important about that is it fixes lots of little things in a more coordinated way. And that's the kind of big step forward that I'm talking about that we need.
So when I think about your frustration, I'm going to ask a question that maybe isn't even crafted correctly. But when I think about barriers to progress, it's inevitable. Any of us who want to solve problems, you can't help but be frustrated because it always takes longer. We kind of think we know what we need to do, and it takes longer than it should. Even think about the Part D that you mentioned. I mean, how long were we discussing prescription drug coverage in Medicare before we got it? Loosely, when I think about the barriers, I think of two dimensions. One is whether or not there's agreement on there's a problem we need to address, and the other is whether or not there's agreement on how to address the problem. And I feel like in a lot of my life, what I've observed is agreement that there's a problem, but appropriate ideological differences in how to respond. I have this nagging feeling right now that we're fragmenting in a different way about whether we even identify things as problems, and that then creates yet another barrier. So I don't know, it's just off the top of my head, but I wonder if that distinction resonates with you, and whether you think we have actual agreement. I mean, people do want to have healthy aging. I don't think there's disagreement about that. But what do you see as the barriers?
I do think there's philosophical differences on the role of government and who should be responsible for different things. Also, because things have grown over time, I'll take long-term care as the interactable problem that is it's hugely expensive, which is also a problem for government to solve when you have giant price tags. And whose responsibility should it be to protect people from this risk? Should it be the family's responsibility? Should it be the individual to prepare for themselves? Or can we pool the risk across society in some ways? And that, I think that is an ideological debate that we're seeing some states say, also, which level of government is it to solve? So we've seen Washington State institute a long-term care program, Washington Cares, that'll start in a couple years, that gives not a huge amount, but over $25,000 for families to self-direct in the expenses. So it can be paid for a family caregiver, it can be paid for a paid home care worker, whatever the family needs. My parents live in Washington State, so I've been watching it very closely. But this is where you see states being the laboratory of democracy. We see that around retirement savings as well, where states are putting in plans to cover workers whose employers don't plan. So I think I keep pushing, I'll just say, and push in the book that these are problems. And again, everybody wants healthy aging. So what are the solutions that we can agree on, and what can we move forward? And so I will always take a little step, but I would love to take some giant leaps, and hopefully some policymakers will read this book. Your brilliant people will also read it and help me come up with better ideas. But I think it's time that we really take demographic change as seriously as we take climate change. We need to have this conversation in this country and around the world in a way that we really haven't been.
So I remember you saying that you're optimistic and frustrated, and then we talked a lot about the frustrated side. So I want you to be able to close out our discussion with where the optimism comes from, where you direct it toward. What do you see that makes you hold on to that side even as you feel some frustration?
I'm still optimistic because I'm still seeing change, right? Again, it's not been we've gone nowhere. We have taken major steps forward. So that, and then I'm also optimistic because I spoke to a lot of people in pulling this together, and we did surveys. And one of the things that people don't realize is that many people are very happy when they age. In fact, there's a U-shaped curve of happiness where people in their 70s and 80s are twice as happy as those in their 40s because they're part of the sandwich and trying to work and raise kids and all of those things. It used to be the other side of the U was also very high childhood. Mental health crisis has meant that those numbers, the happiness numbers, have actually fallen. But as I talk to a lot of people that were really struggling, they're also still pretty happy with their lives and doing really interesting things that they find value. And one of my important tip and trick that I'll leave is Becca Levy's incredible work on how your mental perception of what aging is actually affects your physical health and your longevity. So if you think that aging is a time of decline and misery and all of that, you actually die, I think it's 7 years younger. And it even affects the plaques in your brain and your brain volume. And so so the hopeful part of me is I'm actually excited about getting older. Like I was happy to be 50, and I work and talk to vibrant 90-year-olds on a regular basis. So we need to shift the way we think about aging and the value of older people in this country as well.
Well, that is an encouraging note to end on. And what I like is that the optimism isn't just about public policy. It's about humans and how we respond to our environments and how we shape our environments, and to feel optimistic about people taking charge of that seems like a wonderful place to close the conversation. Well, Deb, thank you for writing the book. I hope you have great success with it. I am confident it will lead to many discussions and that might not have otherwise happened. I think it's great for you to contrast thinking about entering that phase of your life with other phases where there's a whole litany of options out there for how to give you advice. So it's lovely to see the book come together, and it's been my pleasure having you as my guest on Health Podyssey.
It's been a great conversation. Thank you, Alan.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about the Health Podyssey.